But again, I want to continue to emphasize that this is still no time for Georgians to panic. We have no additional cases at this time. Dr. Toomey, my team, and members of the coronavirus task force are in constant communication with partners across all levels of government. I want to thank many of them for being with us today. As you know, I have spoken to the Vice President multiple times. As he continues to roll out information, this is the latest that we have. There are more than 100 confirmed cases in the United States. They're a mix of those who were repatriated into the country and then those that have contacted it in the country. The Vice President continues to stress, as we do, that the risk for the American public remains low of contracting the COVID-19. And we encourage people to continue to use common sense practices just like they would during a normal flu season. Washing their hands, staying at home if you're sick. Don't feel like you have to go out and buy masks and other things that will not help you. So there's a lot of information on the CDC's website about those type things, and we just want people to be very smart about what they're doing. The federal government has suspended all travel from Iran and China and has implemented this highest level of travel advisories for northern Italy and South Korea. I specifically spoke to Vice President Pence about this late yesterday afternoon, and John Selden, who's with us from the airport, will make some remarks and address some of that briefly here in just a few minutes. All direct flights from South Korea and Italy into the United States have multiple screens conducted before boarding those planes in accordance to directives from the State Department. And like all of you, I'm proud to say that our state lab now has the capacity to conduct the COVID-19 testing, which actually started today. More than 2,500 kits have already been distributed to the states. That accounts for more than 1.5 million tests being available. And commercial labs will begin ramping up their own testing next week. As of today, the Department of Public Health has started processing these kits in the lab, and as you know, that has been done a day ahead of where we originally predicted that to be, which was tomorrow.